Accountability and Responsiveness in Informal Settlements for Equity, ARISE project, seeks to enhance accountability and improve health and well-being of marginalized populations living and working in informal urban settlements in low and middle-income countries. The project was implemented in Korogosho and Viwandani informal settlements in Nairobi.
The ARISE project aims to catalyze a step change for health and well-being. Part of the work we did was talk to community members to try and understand what challenges they face in their day-to-day life that affect their health and well-being. And one of the priorities that was identified was water and sanitation and hygiene, so in short, wash.
Choo na maji zinaendana hivi. Sababu tuwezi ishi place hakuna maji na tuna expect tunaenda choo.
Saa hii ukienda kusimama hivi kwa mlango ya choo. Pesa.
Kuna watoto 4 na bibi na mimi, yani watu 6. Raundi moja ni 30 bob. Wakaenda raundi 5 kwa siku. Hiyo ni around 150. 150 ukipiga hesabu na wiki moja. Sasa utalipia choo ama utanunua sukuma bana.
Nini penye choo inaenda as in the waste, it's kwa sewage, and sometimes in a jar, and then ina pop out, then ina cause harm to the environment, like hakuna fresh air to breathe.
We did a study in 2017 together with Nairobi County and the Nairobi Water and Sewerage Company, and some of the findings we found is that only 34% of sanitation waste or wastewater is actually well managed within the city. And here you will find people using pit latrines, and these pit latrines mostly will need to be emptied within a very short span of time because the population density is also very high there.
Shida yenye tuko nayo ni hizi mafu yenye inachotwa kwa matramu. Hina mahali specific yenye wanaenda kumwaka. Wanamwakanga katika mto hii ya Nairobi River.
Mimi naitwa Samuel Chege Mwenda. Mimi nafanya hii kazi ya kuchota choo. Hatuna vitu za kujikiga, hata mask hatuna. Hata zingine ziko na gasi, unaweza kisha hata kado hiyo choo irupuke.
These pit latrine casual laborers provide a very vital service which the government has proved incapable of doing. Therefore, we cannot do without them. They should be catered for in terms of providing equipment for them and also protective gear so as to ensure that they do not contract diseases.
Hii kazi nimefanya miaka 7. Mimi watoto wangu siwezi taka hata mmoja afanye hii kazi. Lakini mimi nawalea na wasomesha na hii kazi, at least wanaweza niokoa mahali.
The ARISE project then, ourselves as APHRC, we are trying to create this platform where the communities, the service providers and the decision makers are able to sit down and co-create solutions for their communities. And this is what we are aiming to do in ARISE.
This project envisions to catalyze a step change in approaches to improving accountability and promoting the well-being and health of marginalized people living and working in informal urban settlements. The project activities involves data collection and participatory activities with communities and community actors so as to link concepts of social determinants of health and well-being, governance, accountability, health systems, and urban infrastructure in the attempt to develop interdisciplinary metrics that explore intersecting inequities. Our approach is interdisciplinary and multi-sectoral so as to work with community organizations, including organizations of urban slum dwellers, a range of service providers, government departments, and other non-government and private actors to stimulate mutual learning in urban informal settlements.
Government cannot provide all the services. The population is high. We have a wash officer, and she's, I think, in touch or networking with the several development partners to sensitize public, because information is power. The government has brought in now the new sewer line, rehabilitation of Lunga Lunga sewer line, which is bigger and more modern. Unfortunately, most of the residents, they are not connected to the sewer line, because it's the main trunk being laid down.
ARISE project recommendation catalyzed a step change in approaches to legitimize and recognize the state need for accountability and responsiveness from service providers, government departments, non-government and private actors, so as to stimulate mutual accountability and responsiveness for equity in urban informal settlements. The study recommendations will empower the slum communities and service providers to demand for services affecting equity. The project team has completed the exploratory phase of mapping social and governance terrain.
Hawa wazee wa kijiji ni hao tunaishi na wao hapa karibu, si ndio? Once wameagree na sisi tunashikana mikono. If we want to do something, we do together with love.
Tuna community venye tunaweza. Kitu kisema the government, hakuna government. Government yenye iko haituangalii sisi. Sisi tufanye venye sisi tunaweza. Pale tatushinda tujue imetushinda.
The government has failed terribly, and the people have to take initiative to come up with solutions.